Good morning, everybody. I'm happy to greet you at the ScanBalt press conference. ScanBalt has been preparing for a meeting in September 2020, already a year ago. And the topic was already selected. This was European Common Data Space. But the events early this year actually made this topic even more actual and urgent to discuss. So we have been working hard throughout the summer to prepare a joint declaration by clusters, and finally 30 clusters, 50 from 15 countries convened on September 4th at ScanBalt annual forum, which was held virtually, to discuss best practices, good examples, how different regions and clusters and countries have been fighting COVID, but also what are the developments and the problems in sharing data cross-border and across the European Union. So today I have honored to introduce you a number of representatives from different clusters that can bring you some examples and also some activities, what we think would be important to pursue to support the European Commission and the public at large to understand and to implement the important network of data sharing and what kind of technical and legal obstacles we have to overcome. So we will start with Lars Lindskjöld, Portfolio Manager in Civil Life. Then we go to Italy, Fiorenza Liparini as a strategic advisor to Lend-Lease, Joanna Feio from Health Cluster Portugal, and Joseph Hilbert from Germany. And finally, Peter Ross from Estonia will bring you some examples and discuss topics. So, Lars, the floor is yours, but before Lars will start, I will just give some housekeeping guides that we don't have questions, voice questions during the presentations, but of course you can write to the chat room. And later, if we go to the Q&A session, then you are please write to the chat room if you want to ask questions, and then we give you a mic. Yes, Lars, so please.
So thank you, Janos, and dear participants of this press conference of a common European health data space. I would like to remind us all that never before the importance of data sharing has been so obvious that during 2020 with the pandemic that is going around the globe. But I was thinking of starting to talk a little bit about space, because space is a very interesting word and we can look at it from different angles. And I think it's important that we see all these perspectives of space. I used to say space is something between, or a gap between something. And in Europe, it's a gap when it comes to the language between countries and so on. But space is also a place to be in or out from. I mean, we can join a place or we could leave a place. That's also important to understand. And we have also the space in time space, that we're following something over a time. And the last one is the cyberspace, that is obviously more looking at the internet and all the things we can share. So if you next. So I was thinking that we need to be able to find things and have them safe for the future, and especially now when we talk about health data. It need also be accessible for all member states on equal permissions. That's also an important infrastructure thing to think about. It needs to be interoperable over time, and it's also reusable for a meaningful purpose. That's very important that we all really think through what we mean with the meaningful purpose. And meaningful for me is to discuss it with others, then it becomes meaningful. Next. I will just give an outlook from the Nordics on the need for a European health data space. And I would like to start with prepare to share. I think it's important that we all have our infrastructure in place before we start to do applications and just things that might seem valuable. I think it's important that we continue our hard work to harmonize data catalogs and metadata around Europe, that we understand the need for real-world data. When we ask for something, it shouldn't be a delay for 1 or 2 years until we have the data. We need to collaborate between the high-performance computing that is necessary in an infrastructure to take care of the amount of data that we are using. We need to increase our cohorts when it comes to scientifics, and we need to continue to look at data privacy protection, as we have stated, to retain control of your data, both as organizations, countries, and individuals. Next. When we have prepared, you can hit next again. We come to the sharing is caring, and sharing is caring is one of the things we have brought forward in this press release. And we think a lot about the FAIR principles, that we have findability, accessibility, and interoperability and reusability of our data that we are producing. We need to do this in a preparation for the next pandemic. We need to do this for the prevention for health. And we need also to have agreed business and incentive models in the European health data space, not run by other countries around the globe for that purpose. Before we are in sharing is caring, please next. We need to share, we need to understand who cares that we share. That's also an important aspect of all this. So as we have stated, we need trusted space for the European health data accessibility. We need organizational and structured processes to have the right to access and contribute to the European health data space. Agency guidelines for institutions, governments, public, private, as well as citizens actors. And I stress it again, data only for a specific purpose agreed on, so in a meaningful way use. So that's what we are talking and discussing in the Nordics. So please, thank you.
Yes, now we move to Italy and Firenze. Please, floor is yours.
Thank you so much, Janos, and thank you all. I'm Firenze Lipparini on the behalf of Demand Innovation District, and as you know, our city and region has been among the most affected by the first epidemics and unfortunately also by the second wave. And I couldn't agree more with what Lars just said. The importance of the common EU data space for health data has never felt more evident than in this dreadful year. So in Italy, we really paid, I think, a high price for the fragmentation of our health data space. We have 21 regions, 20 different IT systems with primary care network, which don't speak with secondary data networks, which in turn means our telemedicine and telediagnostic system often don't work because of the lack of interoperability among and across data services. And we also pay the price for the lack of trust by citizens when it comes to sharing their data. You know, our national app for tracking the pandemic, Simone, was downloaded by a mere 20% of the population. So once again, joining forces among European clusters and working all together, both on the technological side on the standard side, and all the trust building exercise between citizens, public and private institutions is key. The good news is that our private public partners have been working hard. Of course, I'm here on the behalf of the Milan Innovation District, which is made up by one of the largest universities in Italy, the University Statale of Milan, the Human Technopole, which is a large research infrastructure on genomics and bioinformatics, the Hospital Galeazzi, and not less importantly, a lot of companies, research-intensive companies, among them Novartis, Bracco, AstraZeneca, have been working hard together with the anchors to come up with a broad set of projects leveraging on data to overcome the crisis. I will give you just one quick example, which is our attempt altogether to build an algorithm allowing to interface the around 30 biobank digital systems which don't talk to each other right now in Lombardy, therefore making it possible for researchers from every corner on the world to access from a single entry point the large amount of data on COVID samples, which is useful to come up with new diagnostics for tracking purposes and of course to develop new drugs. This is not only about the tech behind it, of course, it's about following common rules, it's about informed consent, which is shared, it's about also building a class of new scientists and professionals of the health system who can deal with these massive amounts of data and find new ways to design experiments which work. You find all the other materials in the background information that we shared. Again, thank you for having us here and looking forward to answer your questions and collaborating together. Thank you, Janos, back to you.
Thank you, Firenza. So now we move to Portugal. Joanna.
Thank you, Janos. Good morning, everyone. I will briefly give you an overview of the Portuguese case regarding health data management during the COVID-19 pandemic. Topics that were pointed out by Lars and Firenza were experienced by Portugal, and we are completely aligned that we really need a common health data space to improve healthcare services in Portugal. So the Portuguese health system is facing a huge challenge fighting COVID-19, as well as all the other European member states. Portugal is on the limit to start performing catastrophe triage on hospitals due to the number of severe infected people and lack of resources such as clinicians and equipment. In Portugal, we have a centralized governance of the public healthcare facilities, where the national government manages all the hospitals, care providers and institutions that are fighting against the pandemic. Aligned with this, we have an interesting level of maturity regarding public health information systems. However, these IT platforms are not so well integrated, which means that there is a weakness when there is the need to trace and analyze this health data. During the pandemic, this weakness gained relevance and turns to show as a major threat to manage the infection by SARS-CoV-2 in the Portuguese population. So in March, we had a problem. The need to test, locate and trace infected people, to forward these cases to specific healthcare facilities and to follow up these cases have shown to clinicians, politicians, civil society, companies and other institutions that we are not really prepared to handle and analyze such amount of information in real time. It also shown that we should start smartly using the data that is scattered all over the care facilities and public institutions. Further, as a parallel effect of the pandemic, the management of non-COVID patients is arising the needs of digitalization of care. It is estimated that over 60% of chronic patients in Portugal miss their annual control visit because of COVID emergency, which led to dramatic consequences for the health systems and most important for patients themselves. So how is Portugal handling this challenge? During the first pandemic wave, the Portuguese healthcare ecosystem, along with the national government, made a huge effort to overcome challenges related with the COVID pandemic and the data management, as well as made an effort to deal with non-COVID patients, regular care, and health data privacy issues that emerged from the civil society. Some examples from Portugal were the platform Trace COVID, is an e-health system promoting telehealth, patient security, and the relief of pressure from health facilities. It is used nationally, provides a full cycle response to surveillance programs for suspect and confirmed cases of COVID-19. It's a health platform for health professionals, and it allows to telemonitor patients, centralize their relevant data in real time, while contributing to informed decisions. That's what was needed in this pandemic. It promotes integration between different IT systems, such as the National Epidemiologic Surveillance System, the National Healthcare Contact Center, and the Citizen Portal. This platform have more than 78,000 of users and have already monitored more than 2 million patients in Portugal. And it have shown the importance of have access to data and integrated data. Another example that arise some issues in Portugal was the Stay Away COVID platform. That is an application that runs on mobile phones, and it is used by citizens. And the objective is monitor citizens' most recent contacts and allow every citizen to know simply and safely wherever he had been exposed to the disease. The application is entirely voluntary and free, and at no time requires access to the citizen personal data. However, many issues have been raised by the population. Only 20% of the Portuguese population download the app, missing an important contribution to the national surveillance program. Most of the justifications for not downloading the app relates to concerns for privacy and security of personal data. So describing the Portuguese case, it is clear we all have a long path on the efficient use of data, data sharing, and the secondary use of data. And we need to start doing it. Therefore, the importance of a pan-European infrastructure, institutions, and a legal framework that support the FAIR principles. So meaning findable, accessible, interoperable, and reusable data is emergent. Sharing is caring, and we need to start doing this. Thank you. Back to Janos.
Thank you, Joanna. As the current activities in ScanBalt and coordinating with different clusters has taken place under EU German presidency. So it's important that we have a sort of good representation from Germany. And Joseph, please give your view from Germany. And we can also add that our declaration will be handed to the German Ministry of Health as an input to the high-level conference that will take place day after tomorrow in Berlin and virtually. So, Joseph, please.
So thanks, Janos, and good morning, everybody. I have the honor to head the German network of regions for health. And in this position, I was asked by the ScanBalt people to organize and share session number 4 in the ScanBalt Forum in September, which was already mentioned at the beginning by Janos. And this session was on digital solutions for a protective elderly care system. And now I will not report on the situation in Germany, but on the results, on the key findings, and on the key proposals of this workshop at the ScanBalt Health Forum. And the findings and proposals are more or less simple. And the first key finding is that we have a lot of interesting digitally supported health solutions that work at least in research and development projects, However, we have a big question mark with respect to the deployment. Indeed, as already mentioned by our Portuguese colleagues and Italian colleagues, we have in Germany as well as in Europe, in many European countries, some kind of a deployment gap. As many of you know, during Corona, COVID-19, it became more or less clear where hospitals, physicians, caregivers, and public health people can rely on digitally supported tools. This helps enormously to identify and avoid infection risk and to treat patients better. And this is particularly true for cross-border cooperations in the treatment of intensive care patients, such as which took place and take place between Belgium, the Netherlands, and North Rhine-Westphalia, or in the Lower Lux countries, France, Germany, and Luxembourg. And what came particularly clear in our workshop, in our forum, on the ScanBalt forum, was that in the field of telemedicine and telecare, health clusters and health regions have conducted a great number of research and development projects. These have created promising prospects for providing high-level professional support to elderly people living at home, which is urgently needed for protecting them from infections. However, we have this deployment gap. Even good evidence-based, digitally supported solutions for disease management or integrated care are only slowly finding their way into real life, into widespread use. Germany and Europe, I underline it again, have a big deployment gap. What to do about that? Our proposals. More or less, Europe is prepared for the next step to exploit digital technologies, improving health and elderly care. However, now is the time to deliver. We have made a lot of promising R&D projects. It's now time to bring them to use. Both health policy as well as health clusters and health regions should significantly speed up their efforts to bring successful pilot projects into wide use. Care-related cross-border collaborations significantly needs more intellectual, political, financial investment to develop and exploit digitally supported tools for the management of intensive care patients. And to overcome the deployment gap, the establishment, that is our idea and proposal, of a EU-wide monitoring report on best practice could encourage political decision-making to go for that. So far to the results of session 4 of the ScanBalt forum in September. And I hope there will be a positive feedback and response to these findings and proposals. Thanks very much, Janus.
Thank you, Joseph. Thank you very much. And now we move to this one of the smallest EU states, Estonia, which is known about the e-governance and elections. So can we see what has happened during the Corona and to the data sharing in Estonia? Please, Peter.
Thank you, Janus. I will start with some reflections from our ScanBalt Digital Forum in September, and especially from the session what was discussing about digital solutions for European cross-border collaboration in healthcare. In general, the aim is to create a single market for health and medical data. But to create such a market, we need to define consistent communication and data standards for intersectoral data exchange. Obviously, member states need to promote implementation of these kind of standards and exchange of data. This obviously puts the citizen at the center of the data-driven economy. And on this slide are the reflections of our multinational discussion. It's obvious that to involve more and more people in data sharing, we need to communicate the benefit of this and educate people to explain more the importance. Unfortunately, the more you inform and discuss the topic, the more issues will be found. However, our conclusion was that disclosing as much benefits and as much activities as possible is important. And positive thing is that there is already quite high, and in some countries very high acceptance for data sharing across the Europe. Nordic countries are especially in the forefront of this. However, people should know for what the data is used, and informed consent is necessary. We discussed also that sharing data gives us opportunity to contribute, and people should be able to be part of the solution. So the more we involve people and the more people agree to share the data for either for research or public health, the better our results. Definitely, there is a need for a secure data capture and exchange, and for that we need confidence for public authorities. And what was interesting was that the advice was that to go as a local level as possible with explaining the importance of data sharing. And this is obvious also during the COVID outbreak now, that if people really see that in case the data is exchangeable, for instance, if you need to allocate patients from one region to other, then and they see the direct benefit, then the acceptance will increase. And you know, one very nice point was that it could be even a patriotic topic for a region. And we, of course, we discussed a lot about data protection, and data protection should be considered as personal protection. And for that, we need to know the mission of the data use, the protocols, and so on. So this was about the cross-border collaboration and the importance to educate any level of the society about the importance of data sharing. Now, here is an example from Estonia from last spring, when we had the start of COVID outbreak, and we recognized from the very beginning that there is a big mess in COVID reporting statistics. The reason was that the reporting of infectious diseases was responsibility of health board, which actually handled the data as secondary data, and therefore they were responsible for cleaning the data, and everything took too much time. Next, please. What was the solution? Using Estonian distributed health information system, nationwide system, where actually the collected data is in a quite high extent standardized. the process was quickly re-engineered, which means that instead of sending the data directly to the health board, the COVID-related data was sent to the nationwide health information system in a standardized way, cleaned there quickly, and then results were sent to the health board to make this also public as open data. And obviously this was one of the very important factors to calm down the society, that everyone had online access to the data, how many infected people are there daily, how many hospital beds are occupied, and how many ventilators are still there available. So data is important, and data sharing is even more important. Thank you.
Thank you, Peter. So our conclusion and our statement, what we have been reiterating during this process is sharing is caring. And the main outcome from our work and our declaration, the declaration what was coordinated by ScanBalt, it's more precise to say, is that we need much more exchange of patient-related data in Europe and to combat the pandemic. And creation of a single EU data space is more urgent than ever during this pandemic, which has been proven in all countries. And the second main takeaway was that the innovation centers of science and research, the European data space has long been reality. This means that we have already some good examples, but now there is time to create a cross-European uniform legal framework that explicitly regulates the handling of patient and research data for all patients, all parties involved, like public health, academic research, private research companies, startups, and so on. So it means that we need data for primary use as well as secondary use. And the third important point is that the free European data space will not work only for all citizens have access to their complete, underline, complete electronic health record and remain in control of it. But it has to be also done under the basic data protection regulations in EU. And for all this, we obviously need quite a bit of work to do to actually make this reality to be implemented smoothly across the EU. So we have reached to the end of our presentations, and we are happy to take questions. We have also, in addition to the mentioned speakers, we have also with us our ScanBalt Vice Chairman, Oliver Stenzel, who is actually representing Novartis Germany, but is very active in the process of European Common Health Status space for public benefits. So please, we are happy to take either written or voice questions. Please let us know. So if we don't have any questions, maybe Oliver, do you want to say something to add to the panelists?
Thank you very much, Janos. Very impressive presentation, and I think it was really visible that the civil society organized in this ScanBalt forum highlighted the main aim from all over Europe, that digital health data is a really precondition for doing research together in Europe, and that the Corona crisis, COVID-19 crisis, has shown that we need this cross-border collaboration in Europe, and that the innovation, even more on healthcare topics, come from the regions, from the scientific regions in Europe, and that they have to get the ability to organize themselves and exchange data, knowledge, experience, and innovation. And that I think this is especially the European way of digital health spaces, that it's a regional perspective and that the innovation within comes from the different regions. And I'm very happy that the European Council Presidency, the German Council Presidency, will highlight this in this forum that will take place next Wednesday, where there's also a perspective of the European way of creating a health data space.
Thank you very much.
Okay, I go on mute again. Thank you.
So we have one question here from Jean-Luc Tomasini. So it's obviously to all panelists. Do you have a panel about the percentage of the download applied to follow the contact chain in European countries? So who would like to start? So obviously we don't have pan-European system, but is there any comments from the panel? Peter, can you start?
Well, I have any data to add here, so I will give over.
So anybody who has opinion of this or comment? Fiorenza?
As I said, I mean, I know the Italian situation more than any other EU country. The stats is about 20% with a very low uptake. So it started a bit too late. That was one of the issues. The perception by the Italian public was that it was too little too late. It's still been a big investment. So 10 million euros for a 20% of uptake is not a great result. I was surprised to hear Joanna is the same exact rate in Portugal, and also the reasons are the same. So lack of trust, concerns for privacy, not knowing exactly what will be done about the app. In Italy, we can add that the few cases, I mean, in a few cases, it didn't really work because it's too time consuming. You still need a lot of data input manually by health authority. So it's not user-friendly enough. I don't know if from other countries you had similar issues.
Joseph, can you comment on Germany?
Not really with respect to these issues. However, there is a further question by Ashley Furlong, and maybe I can give some response and answers to it. And the question is, where are the biggest hindrances, obstacles to the European health data space? I had a focus in session 4 on things like telemedicine and telecare. And what we learned is that we have a lot of hindrances to realize the potentials of telecare and telemedicine. And the biggest hindrance is that there is no real working legal framework for the reimbursement of the health activities that can be delivered by telemedicine and telecare. That is one of the biggest hindrances. We are prepared to go for the next steps, but we do not know how to overcome the problems from pilot project to wide use. And there, the main obstacle is finance, funding, budgets. And there are some further steps to widen and broaden the landscape of pilot projects in specific contracts and specific regulations, but not yet the big step forward. And the only thing I think I can foresee is that regions have to develop step by step, by collaboration, the wider use of these solutions, and to knock at the doors of the regulation makers to act responsible and find solutions for wider funding systems. That maybe is an answer focusing on telemedicine and telecare, on how to work with the big obstacles and hindrances. But more or less, we are not in such a bad mood. It's now the time to make the next steps. And many government people and many policy makers are aware of the situation. And in so far, we are very happy to, let me say, to give additional fire to the public debate on that. Thanks.
Thank you. Joanna, do you want to add? There is also some questions about the confidence, about that the provision that allow for data sharing is not well understood, that we have confidence in our local authorities perhaps, but we don't have so the pan-European confidence to the European structures, as I understand from these comments and questions in the chat room. Joanna, do you want to comment on this?
Yeah, so the Portuguese reality is, as I explained, so we have a kind of mature information systems that have a core bone, and the specific data sets are shared along all the national IT systems, and also a specific data set is shared with the patient. And at this level, we think that we have this for, I think, 4 or 5 years. The citizens have confidence on what is being shared. And the pathway to get this was very hard. So the Portuguese government had to improve the use of standards and infrastructure. And even so, we have some limits. So what happened during the last 4 years? It was we created a pathway that was step by step. It was hard. So we know that we need to use standards. We need to share data, but we are only sharing a specific data set. When the pandemic comes, we need a broad data set of data, and we were not allowed to do it due to the different kind of data that we have and the infrastructure. And when we need patients to come aboard and to start providing their own information of location, and if they were with other patients that were infected, we felt that then patients or citizens start to think, why I'm doing this, why they want my information. So we need patient literacy or citizen literacy before we start doing things. And at the same time, they don't have confidence if this data was only used to locate chain infections, or if the government will use this data for more things. So information is needed. Standardization is needed, infrastructure is needed, and a legal framework that turns this more light to be implemented is also needed. So I think that in Portugal we are making the road, but in a very slow path. And that is what I can add for this. Thank you.
Thank you, Joanna. Lars, what about the view from Sweden and Nordics?
Yeah, it's been a great discussion, this, and I really don't know where to fill in with all the others. I think that Joseph brings up one important thing, and it's how we do innovation to be something in practice. That's a long time for us to be there. And I don't think it's only about the money. It's also about our, as politicians and institutions, our ability to make the change. So it's a lot of the culture change. And Johanna point out with the digital literacy of our citizens, that for me seems to be a very important topic to bring forward. Also in combination with the digital literacy of the professionals, because the professionals are not always in the same way of thinking on how to, what it could mean to share this information. And today, with our culture of more and more data, it's difficult perhaps to get the quality of the data, because we still have humans that needs to stamp them into the computer, and you, as a person, you don't realize the importance of that. So I think for the future we will see more and more about, you know, automatization of processors, using sensor for this purpose, and so on. And I also think it's important for us to understand how much of those things that already exist with others. I was a little bit shocked myself in Sweden when we had our telecompany to show how we traveled around in Sweden during the pandemic. And then suddenly you realize, oh my God, they know everything, not on a personal level, but at least on a group level. And I think it's important that we bring this up for the citizens to see that we are rather controlled already. So I don't know if it was an answer, it was more of some thoughts. Thank you.
Thank you, Lars. We have also some comments on who is the European authority you trust, from Sebastian Hoffman. And we have also some comments perhaps from Oliver on the aspects of confidence. Oliver, please.
Yes, thank you very much. I think Joanna and Lars already mentioned that main point will be the empowerment of the citizens, that they get really know about the data, and that they really know in every circumstance what will happen with their data. And I think they have to understand themselves as owner of their data, and precondition will be the electronic health records that everybody can use and decide how to use it, where to use it, and with whom to share the data. But I learned in the ScanBalt forum another point, and it goes in the direction to Sebastian's question. What was obvious is that good examples on sharing data always happen in really concrete cross-border collaboration between Germany and the Netherlands, between Sweden and Denmark. So I think perhaps we have to start locally, or more local, with concrete cross-border examples where the people can see that they benefit from exchange of data. And then you have concrete or more concrete authorities you can trust in. You have still your local authorities, and you have the authorities from your neighbor state, and you know that they are dealing with your data. And in my view, this could be a beginning, this cross-border collaboration, cross-border exchange of health data, and then you can broaden it and go all over Europe, or include other additional countries or circumstances where to use the data. Thank you.
Thank you.
Oliver, please let me add a little bit on your focus of regional collaboration. We asked, and we went and proposed a lot of work on developing the legal skeleton arrangement, the legal frameworks, and regulation frameworks on the European level and in the European member states. However, we have the opportunity to also go for collaboration between regions. And to give you an example how it works, we had in the Ruhr area this first network of teleradiology providers. And we communicated these activities in different regions, in different countries, in different states. And with the help of this regional collaborative support, it grew and grew and grew. It's now around 500 facilities which joined this network, even cross-border facilities. And there you can see that regional activities can make a difference. And that is one very relevant future path we want to go, and we want even to go with this ScanBalt network, which is an excellent opportunity to go for international regional collaboration.
Thank you, Joseph. So there might be also some good comments and examples from Peter Ross on the personal ability or person's empowerment to control the data. How can it actually contribute to the acceptance of the data sharing? Peter, can you elaborate on this?
Thank you, Janos. And thank you for previous speakers about elaborating the importance of data. I would divide trust to this digital environment into two. One is trust about the data. So how trustful are these digital data we collect? And I think this topic was very well elaborated already. And once one of the quality properties of the data is also usability, then these cross-border cases or cases cross-sector cases, what show a real benefit of sharing of data. And COVID has actually bring many of these kind of cases on the stage. I think this is a very good example and very important. However, we have to work on the European level to harmonize the communication standards and the data collection standards. This is a big topic, but we have to deal with. Then another topic is trust of the people about the authorities, who is using our data and so on and so forth. Estonia has very interesting and promising experience. All our residents have access to their electronic health records, but not only to the medical data, but also to the log trails, which means that I, as a person, could always open my patient portal website and see who, when, and what has looked at my electronic health record. So this is very powerful tool, and if we implement log trails and technologies like hash chain or blockchain to control the usage, this, at least from the Estonian perspective, has appeared to be really a tool what improves trustfulness to the authorities. Thank you. Over.
Thank you. So there is still question from Sebastian Hoffman. May I ask, who is a central authority you trust? So maybe we do the quick round along the panelists. What is your opinion? What is a central authority we can trust? Do we have to trust any central authority if we have actually distributed system and people can control the data?
Maybe I should start.
Yes.
Oh.
Forenza, yes, please.
Yeah, so, well, one thing is the marvelous diversity of European countries. So, for instance, in Italy, we tend to trust much more the European level than the local one, let alone the national. And there are very precise stats about it. I think there are central authorities which are trusted, like the European Medical Authority, for instance. I wouldn't have particular problems in trusting the know-how. At the same time, I think that both the technology and the governance system we enjoy allow us to look at distributed systems as the best way to go with everybody on the same page. I just want to go back just a minute on the next big challenges. We are still looking at how to make data interoperable. We should start also looking into the analysis side, because, you know, as good as the data set can be, they also need good algorithms and machine learning in order to be used. And on this, at least in Italy, one of the big issues, the big challenge we see is that most of the algorithms where you have enough track record and work are based on English text, while our personnel, medical personnel, and our citizens input the data in Italian, and there is very little semantic analysis on this. And I guess that's true for most European countries. So I think this is a good challenge for our cluster to think in the future, just throwing it.
Thank you. Thank you very much. Joanna, can you elaborate a bit on this? What central authority you think we should trust, if any?
So I think that in Portugal, citizens more or less are confident on the health ministry and the authorities like SPMS that are the authorities that manage data, health data. Regarding European case, I think that this digitalization area bring a new need. So we have the medical authority, European Medical Authority, we have the European CDC, but we need to now to have an authority that look to the healthcare and the clinic way, and also the IT things. So now we have an hybrid new material that is health, IT, and data. And this authority needs to regulate and look to the disease and also the way this disease is managed by digitalization. So this new authority we need to bring to the same table different authorities that think on the clinical perspective and also in the infrastructure and IT things and privacy and legal and ethic. We need to have everything, one head thinking on all of this to give confidence that every topics are being analyzed, and so the population can have confidence on the issues that are raised by this authority. This is my perspective.
Thank you, Joanna. Lars, a short comment before we have to end.
I fully agree with Johanna about those thoughts, and I think the one you trust is the one you communicate with. So it's important that we understand to broaden the communication. And if I look from the Nordic perspective, I think that most of the Nordic countries trust their governments to take the communication back to the European Union. And we have the gold opportunity now to discuss from Johanna's perspective if we are going to support to create a European health data space, then we need to bring a lot of trust into that discussion with the civil society. Thank you.
Thank you. And to end with Joseph.
Yes, thanks. So decades ago, I had a focus on Marxist theory, and I remember the key message from Karl Marx is doubt everything. So far, trust is a very, very volatile issue. Nevertheless, our joint declaration gives an answer, and the answer is ECDC. The European Center for Disease Prevention and Control. In present times, it seems to be yes, reasonable to trust these institutions and to develop this further. That's the first step. And then I extremely underline what Lars said. The one you trust is the one you communicate with. And to do this in a better way, it is helpful to have some kind of monitoring system, which gives you the transparency on where is progress, where are bottlenecks, where are attacks, and things like that. Insofar, communication, however, based on a monitoring system. ECDC communication monitoring system.
Okay, thank you. And we have maybe the last question, which can be maybe best addressed by Oliver as a leader of the process behalf of the ScanBalt as a vice chairman. So what will happen to the declaration, Oliver?
Yes, what will happen with the declaration? So as you know, the declaration was created as part of the official program of the German Council Presidency. And that's our main use now. So we will pass it over to the German Ministry of Health. We already have done it, and give it to them as the input from civil society for their upcoming activities regarding the European Health Data Space. But we will also elaborate it further. So when I look at Joanna and the Portuguese activities in our group, I'm happy to see that the upcoming Portuguese presidency could also be part of our activities, and that we will prolong this discussion to the next presidencies on the European level, and that also the input from the European Commission for the European Health Data Space, that we will go ahead with public consultation and giving our input also to the European institutions on the development. So I think this is a long run. It's more a marathon than a short run, and that we have the possibility to bring in the ideas from the regions in the upcoming processes on European and national levels. So thank you very much.
Thank you, Oliver. And perhaps, Joanna, you want to comment, a short comment on the plans for the Portuguese presidency? Do you have also already something to tell us?
Yes. So we are planning to handle the declaration for the Germany government and steer it in Portugal and with a reflection for Europe. So we want to improve the discussion, what should be implemented. We want to give awareness of all the issues that are blocking the implementation of a European data space. And we want to turn these pilot projects that are scattered along Europe on real implementations. So these are the objectives that we have for the next year. And we will work on this with our health ministry and the other authorities.
Thank you very much.
Thank you.
So it has been a wonderful opportunity to actually give you insights on the process that has been coordinated by ScanBalt. And we'll be happy to take further questions by emails or by messages. And if any of the participants of this press conference want to get into more detail with some speakers, or otherwise with some representatives of clusters involved, please let us know. We can arrange interviews or at least answer the questions. And we are very hopeful that the European commentator space will come to reality sooner than later. and I hope that it will happen in the next few years. But of course, the process is not easy, and we have such a diversity across the European Union. But meanwhile, please give your thoughts to us, feedback, and if you feel like you can and want to endorse the declaration, so you can do this on the website. So thank you very much, and we are happy to inform you about the next steps over the communication channels what we have now. Thank you very much.